This is a program evaluation proposal of the First Nations Health Authority Indigenous Wellness Program. This program evaluation is intended to focus on BC First Nations community members' feedback regarding the Indigenous Wellness Program offered by the First Nations Health Authority to BC First Nations communities and their members. In response to a public health emergency on opioid overdose in BC, the FNHA Indigenous Wellness Program was established in order to bring culturally appropriate harm reduction and healthy sexuality workshops to BC First Nations communities. It was a response to address the disproportionate number of BC First Nations people passing away as a result of an opioid overdose. It is imperative to create services and provide resources within BC First Nations communities, but to do so in a manner that is collaborative and inclusive, where the community is asked to contribute to the design of the culturally relevant curriculum development. A public health emergency was declared in BC in April of 2016 because of unintentional drug overdoses from tainted opioid supplies. In 2015, there were 518 overdose deaths, and according to the BC Coroner Service, from January to October 2020, there was 1,146 deaths. First Nations overdose deaths increased by 93% in 2020, and they are disproportionately represented at 16% of the overdose deaths compared to other British Columbians. First Nations women died from an overdose 8.7 times more often than other women in BC. There is also an increase in sexually transmitted infection among Indigenous communities at rates higher than non-Indigenous populations. This suggests there is an increased need for education on healthy sexual practices to prevent sexually transmitted and bloodborne infections in Indigenous populations. The First Nations Health Authority is the health and wellness partner to over 200 diverse First Nations communities and citizens across BC. FNHA has 5 regions in BC. The FNHA Indigenous Wellness Program serves BC First Nations communities and their members. First Nation Health Authority, mental wellness and substance abuse. What is mental wellness and substance use? Mental wellness means a lot more than the absence of mental illness. It takes in all areas of a person's life. Mental wellness is the presence of factors that promote and maintain physical, mental, emotional, and spiritual balance. Communities have been working to address mental wellness and substance use issues and to restore balance. FNHA supports this wellness approach and recognizes the rich and diverse assets within communities and regions and the many promising and successful practices undertaken to date. The Indigenous Wellness Program is responsible to create culturally relevant curriculum and workshops that promote harm reduction and healthy sexuality within First Nations communities. Harm reduction is a pragmatic response that focuses on keeping people immediately safe and minimizing death, disease, and injury from high-risk behaviors. Healthy sexuality covers 2 main areas: sexually transmitted infection and bloodborne infection. Indigenous Wellness Program principles include Indigenous harm reduction principles in practice and take-home naloxone training, as well as healthy sexuality workshops and presentations that provide Indigenous perspectives on harm reduction and healthy sexuality, which includes community conversations on HIV, Hep C, and STBBIs. The research question for this program evaluation is with the main objective that is intended to determine if the FNHA Indigenous Wellness Program has improved access to culturally appropriate harm reduction and healthy sexuality information and resources to BC First Nations community members. The long-term impact that will not be measured by this evaluation is to reduce the number of opioid-related deaths and increase the harm reduction services used by First Nations people on reserve in BC. From each nation selected, 50% of the participants who attended workshops in their community will be invited to participate in a data evaluation survey. Each participant will be assigned a unique number, 1, 2, 3, etc. A blind randomization process will be used to select participants by drawing numbers out of a jar. Potential partners who might be interested in this proposal for the evaluation of the Indigenous Wellness Program in BC include BC First Nations community members, BC First Nations health workers, as well as First Nations leadership and provincial leadership. The project model outlines the key inputs, the key activities, and the key outputs. Model outlines the key inputs. The theoretical framework used in this program evaluation is called Shaw-Switzossen. Shaw-Switzossen, We Are Going Cedar Stripping, is an Indigenous research methodology that is grounded in Nuu-chah-nulth worldview, Hishuik-Sawak, which means that we are all one and we are all connected. Cedar is used metaphorically to represent bringing together research with outcomes. It is based upon the values of the 4 R's: respect, relevance, reciprocity, and responsibility. The weaving together of cedar Chakmis bark is the action implementation phase of research, and it represents weaving together research findings or program evaluation data, values, ethics, and capacity development as a means to restory our collective story of social and economic inequalities which underlie health disparities in Indigenous populations. In the context of this program evaluation, Shaw-Switzossen is appropriate to determine the significance of developing and delivering culturally appropriate workshops of harm reduction and healthy sexuality in BC First Nations communities as an Indigenous approach to evaluating health research. The sampling methods used in this program evaluation will be conducted on proposing 30% of BC First Nations communities who participated in accessing the Indigenous Wellness Program services between April 1st, 2017 and March 31st, 2018. Each First Nation will be assigned a unique number, 1, 2, 3, etc. A blind randomization process will be used to select nations by drawing numbers out of a jar. From each nation selected, 50% of the participants who attended workshops in their community will be invited to participate in a data evaluation survey. Each participant will be assigned a unique number, 1, 2, 3, etc. A blind randomization process will be used to select participants by drawing numbers out of a jar. A data collection survey will be used. It will include questions to determine if the participants previously attended workshops outside of their community, as well as if they were satisfied with the material, presentation, and resources available during the workshop they attended. The surveys will be distributed by way of mail to the participant. The importance of the findings of this program evaluation are to determine if culturally relevant information and resources regarding harm reduction and healthy sexuality are reaching BC First Nations community members, and if they are satisfied with the material and presentation method. In the current climate of the public health emergency regarding overdose related to tainted opioid use, the findings of this program evaluation are relevant to provide evidence of meaningful, relevant services reaching marginalized populations such as BC First Nations community members residing on reserve who would not have otherwise accessed services off reserve.